Good afternoon, and thank you for joining us for this briefing on COVID-19 and our community's local response. Joining me again is interpreter Francis Bovaraj. Thank you, Francis, for being here. And thank you to the media and all to our residents who are tuning in today to learn more about how you can protect yourself, your loved ones, and our community. More information can be found at our website, covid19.lincoln.ne.gov, and we encourage everyone to look there for resources and accurate, timely, and reliable information as we navigate the pandemic. A situation update is that we have had one new case of an individual diagnosed with COVID-19 in Lincoln today. The total number of lab-confirmed cases of people diagnosed with COVID-19 now stands at 57. The case reported this morning is a man in his 30s, and the health department investigation has determined that his case falls into the community-acquired category. This means now that 40 of Lincoln's 57 cases are community spread. And here to share more information about the health department's investigations is our interim director, Pat Lopez.
Good afternoon. The new case reported today is isolated and close contacts or self-quarantine. Nebraska now has 871 cases, and we've experienced 18 deaths, which includes the one death in Lincoln last week. With the additional case today, Lancaster County is at about 3.3% positivity rate. That's the number of positive cases compared to the total number of tests completed. The state is at about 7.7%, and we are at about 16% positivity rate nationally. We want to again emphasize today that there is more testing available. We strongly encourage people to use the drive-through testing options that are open in our community. Bryan Health can do 80 to 100 tests per day, and CHI Health can do about 30 per day and is prepared to add additional tests as necessary with community demand. The simple process for both locations begins with a free online questionnaire. Those who have symptoms of COVID-19, like a fever, cough, sore throat, should visit chihealth.com or bryanhealth.com. The questionnaire will assess your risk, and if testing is recommended, you will be given an order and referred to one of the drive-through testing sites that are available to the public 7 days a week. CHI Health's drive-through site is open from 3 to 5 at North Star High School, and that's at 5801 North 33rd Street. Bryan Health drive-through is open from 1:30 to 4, and it's at Life Point at 7501 South 27th. Once you've been tested, you will be asked to self-quarantine at home until the test results come back. Generally now that's within 48 hours. There's been tremendous improvement in the response time of reporting the findings from your test. Again, if you are experiencing symptoms, this is a convenient testing option. You don't have to get out of your car, and the process prevents potential exposure to staff at your doctor's office or at the hospital, and we urge you to consider this.
Thank you so much, Director Lopez. And again, we encourage all those who have symptoms of COVID-19 to please use free online services provided by Bryan Health and CHI Health. We want to thank both Bryan and CHI Health for providing drive-through testing that is convenient and safe. The expansion of testing is another way that we can prevent the spread of the virus. And just to say a little bit more about these incredible hospital partners, they are collaborating as if they are on the same team. This is an incredible thing to witness, and our public health officials can't stop commenting on it enough to see Bryan Health and CHI St. Elizabeth working together to help provide a network of care, regardless of where people might normally go to seek medical care. It's just gives us so much hope about how we are getting through this pandemic together. And to all the nurses and doctors and other staff at these hospitals, thank you for what you're doing on the front lines to bravely serve during a time that is unprecedented. We appreciate you so much. We want to also address the fact that although the risk of severe illness may be different for everyone, anyone can get and spread COVID-19. So please continue, everyone, to do your part and to help slow the spread and to protect yourself and others, and of course those people in our hospitals and our medical care facilities who are on the front lines. With the increase in community spread cases, we all should just assume that the risk of exposure is everywhere and anywhere in our community, anytime we're out in a public space where other people are present. Again, the actions that we all take during these next 3 weeks are critical. Please abide by the recommendations of local health officials. First and foremost, stay home. Refrain from non-essential errands and gatherings. Work from home if you can, and use the 6-foot spacing rule in your workplace if you must go to one. Shop alone and only shop for groceries once a week. Keep your kids at home. They should be playing at home, not with friends outside of the home. No group sports and no playgrounds. All playgrounds in Lincoln remain closed. Help seniors stay home by shopping for them. Visit with them through email and phone calls or texts rather than visiting them in person right now. And while it's important to exercise, please observe social distancing guidelines while you do it. And last but not least, wear a face covering when you are out in public. These kinds of recommendations can feel like a lot to digest, and they are. This pandemic has upended life in ways that we never could have foreseen and challenged us all to adapt to really incredible circumstances. Over the course of the last 45 days, we've all had to make adjustments in the way that we do our work, the way that we take care of our families, and how we contribute do our part to prevent this virus from taking hold in our community. Our team here at the city has also adjusted to the way that we do business in order to provide needed services to our residents during this pandemic. And 2 weeks ago, we discussed some of the changes that we are making to our StarTran transportation services to adjust to a significant decline in passengers and to protect both our bus drivers and the passengers that we serve. Back then, 2 weeks ago, we discussed a new microtransit program that we plan to implement this month. I'm happy to report that the new system will be ready to roll next Monday, that's April 20th. And here to provide more details on this new service is Liz Elliott, our Director of Lincoln Transportation Utilities, and our StarTran Transit Manager, Mike Davis.
Thank you, Mayor. We are very excited to announce the pilot project, the StarTran On-Demand Service. As Mayor indicated, this pilot project will begin Monday, April 20th. The service hours are going to be starting to pick up at 5:40 a.m. with the last pickup at 8 p.m. Monday through Friday. On Saturdays, the first pickup will begin at 6:30 a.m. with the last pickup at 6 p.m. There will be no service on Sundays. This pilot project is to correspond with the StarTran bus route time schedules. It will be $5 per trip for this service, and that is because this is a door-to-door service. We will continue to not collect fares temporarily on our fixed route schedules and our handy van services. In order to schedule a ride and pay for it, you do have to go through the app, and that is VanLink, VANLNK. And that is available for both Android and iOS users, and you can go to your local app store to download that app. That app is available for download now, so you can be prepared as soon as service starts on Monday morning. Additional information will be available on StarTran's website by tomorrow morning. We currently are planning a minimum of 15 vans that will be available for this service and can go up to 27 vans depending on the demand and the availability of StarTran bus drivers. It is a shared ride service, which means there could be more than one person riding in this, but we are limiting it due to the current situation to 2 passengers only. And that could be 2 passengers being picked up at the same location, or they could pick up 1 person at the location and pick up 1 additional person along the way. The benefit with this service is that the riders who have requested pickup can actually see on the app the route that the bus drivers or the van drivers are taking, and they can get an estimated arrival time for them. This will allow riders more flexibility when they need ride service, and hopefully fill in the gaps for those services in the early morning hours and later in the evening due to the reduced fixed route schedules. All vehicles are lift or ramp accessible. Let's see. If you do want to reserve a trip, they are limited to same-day bookings for the on-demand service. If you have any additional questions, please go to the StarTran website or feel free to call StarTran for additional information. Thank you.
Thank you, Liz. We're really pleased to provide this supplement to our transit system to ensure that everyone who needs safe, reliable transportation is able to access it during these challenging times. And if the pilot project is successful, this system will benefit our handy van ridership even after the pandemic has subsided. Moving on to other city service changes, we of course continue to reevaluate how to do business as a city in order to encourage more residents to stay home and stay healthy. And we have another change to announce today. The Aging Partners offices at 10th and O Streets downtown will close to the public beginning tomorrow. Customer traffic has slowed to a trickle as our staff there has migrated to providing services electronically and over the phone. Those who will still need a face-to-face meeting will be able to do that, but it will have to be by appointment only. As a reminder, all Aging Partners senior centers and the fitness center remain closed, and all events and training programs are canceled until further notice. The work of our Aging Partners team is a vital part of caring for vulnerable members of our community, and we are committed to continuing this service throughout the pandemic. The meal delivery that Aging Partners is coordinating instead of serving hot meals at senior centers is just one example of how Aging Partners is providing important care and staying connected to Lincoln seniors. With that, we will conclude with some good news. To help reach more in our community with important messages about how to stay safe, to stay healthy, and stay connected, the Lincoln Chinese Cultural Association will be hosting a webinar on COVID-19 for community members this evening at 7 p.m. That's tonight at 7 p.m. The webinar will feature Dr. Hong Chui from Bryan's Urgent Care Clinic and Dr. Ming Chu, Public Health Administrator with the Nebraska Department of Health and Human Services. This bilingual presentation, provided in both English and Chinese, will include information about COVID-19 symptoms, prevention, healthcare resources, and local updates. And you can find more information about this webinar and register at the Lincoln Chinese Cultural Association's website, which is thelcca.com, thelcca.com. Finally, we are seeing people in need more than ever before, but we are also seeing small acts of kindness that address those needs. Bridges to Hope, a nonprofit helping those soon to be released from incarceration, shared this story with us. While it paints a picture of the stark realities that some are facing in our community, it also illustrates the depths of compassion that define who we are as people here in Lincoln. One of Bridges to Hope's employees was pulling into Bud's Thrift Shop, a fundraising store that they operate, but which has been closed for several weeks due to the pandemic. As the employee pulled up to the back door, she noticed a woman on a bike with no shoes and only a jacket on and a slip for a skirt. The woman was looking through the garbage cans to see if there were possibly some discarded clothes that she could use and wear. The employee immediately invited her into the thrift shop to see if she could find something for her while still being mindful and maintaining physical distancing guidelines. The employee made sure that the woman left with 3 pairs of jeans, 3 pairs of tennis shoes, and money to get herself something to eat. Small acts of kindness and generosity in difficult times are how we lift up and help those in our community who are most vulnerable. And these small acts of kindness and generosity are in no small part how we will get through this challenging moment together. With that, I'd be happy to open it up to questions from the media. We have, again, Director Lopez here. We have our Director of Transportation and Utilities, Liz Elliott, here, and our Star Transit Manager, Mike Davis, here, all available to answer questions.
We have a question from Lynn Fisher at KZUM. Well, Lynn wants to know, are the vans owned by the city now?
Thank you, Lynn. I'll have Liz come up and take that.
The vans are currently owned by the city. There are 6 that we are leasing, but there are vans that we've had and have been using over the last few months.
Hi, Liz. Riley Johnson from the Journal-Star. How many trips does the city anticipate kind of in the early on? And is there a sort of sense for, how many riders that are currently on the buses will be migrating over?
I don't know that we have a good estimate of that, but I will actually invite Mike Davis to come in, and he might have a better estimate than I do currently. It's really hard to anticipate what the demand is going to be because this is such a new service, and because there is a limited fee, the $5 fee on the on-demand service, where the bus routes still, we're not collecting the fees. It's unclear whether or not that will play a part. But I'll invite Mike up here to see if he has any additional information for you.
Yeah, this is a new service. We don't know how many people will be using it, especially during the pandemic. We do know that we have a capacity not to exceed about 500 trips a day, but we anticipate that being much smaller, probably in the 100 to 200 trips a day.
Other questions?
I've got one, Riley with the Journal-Star here. How many patients with COVID-19 are hospitalized at this time, and do we have a sense for how they're doing?
I'll bring Director up to answer that question for you, Riley.
Thank you, Mary.
Hi, Riley. We currently have 4 patients hospitalized, and we'll receive new data and be able to report on that tomorrow again. Our current understanding is that the patients are doing well at the present time.
We have another question for Pat. Lynn Fisher at KZUM asks, has there been any increase or news about test kits for Lincoln Healthcare Systems, especially the Abbott Test?
The Abbott Test, we have put in a request for 4 of those machines. We do have some here. We're hoping that we'll receive the machine soon from the federal allocation. But we also have some of our health systems do have the machine in place and can convert to that. Like everything, it's the reagent but that we need for that. But the reason that we're talking about increasing testing is that we've been able to secure more test collection tools. So we're actually able to expand our testing in the community, and we really want to do that so that we can have a better sense of what is happening in the community, since we have so many community-acquired cases. So even though there's still a limit on the reagent for the Abbott test, we're able to do the other testing and within 48 hours have a response. CHI is doing their own testing in-house, running it. It's still 24 to 48 hours I know Bryan Health System is looking, as soon as we can get reagent available, they'll be able to do testing in-house. So we've made tremendous progress from where we were even a week ago. So thank you for asking.
Hey, Pat, this is Bill at 1011. Quick question for you. I'm seeing that the first case was on March 20th. I know the state is not tracking recoveries. I'm assuming the city and county also is not retesting people that are self-isolating. But since we are now at 25 days since the first case, do you have any idea of how many people that have been diagnosed with COVID-19 are now symptom-free, have waited the proper time period, and are back out in the public?
Well, we actually were just having a discussion about that 2 hours ago, and we're putting some of that together. So we'll include that in our report tomorrow. But we do know that there's been a successful recovery for all the individuals that were self-isolating for that period of time. The issue has been, to technically say that somebody has recovered, you have to have 2 negative tests. Well, all the patients who've been hospitalized have those tests done, but in the community, due to the scarcity of testing, that hasn't always been possible. So we should have some update at least tomorrow to tell you how many people have self-isolated and have recovered since that time.
If someone has recovered, can they go back to work?
Generally, we have a process where we work with them through our communicable disease nurse and staff. And if they have recovered and they're symptom-free, there are some CDC guidelines that talk about temperature and symptom, define how long those have to be absent before. So we follow that process very carefully. And I have to say, all the individuals we've been working with are very conscientious about that, as well as their close family members.
I have a question about the StarTran pilot program. Was this in the works before the pandemic, and can absolutely anybody request a ride?
I'll take the first question first on was this in the works? Yes, this was in the works. However, it was more to streamline and make the process more efficient for the handy van service, and that was going to be its limited purpose, at least initially. This plan was to roll out during this summer, so we have advanced it 2 to 3 months. And we've expanded it because originally it was just for the handy van services. However, given the reduced route schedules, the social distancing recommendations, we thought this would be a great opportunity to try and provide some additional services to fill in the gaps, as well as maintain both driver and passenger safety and health. The second question, and I apologize, I forgot all of a sudden. What was the second question, Bill?
No, that's totally fine. It's just, can anybody in the city use this service?
Thank you. Anyone can use this service. The primary purpose of this is the handy van, first and foremost, because that was the initial intent for this. Those handy van customers will continue to have this service free of charge, and they are currently registered in our system, so we know who those individuals are when they either call in or schedule their rides on the app. And then the second group of individuals is just anybody in the public, as long as they pay the $5 ride fee and they have the app downloaded, they can utilize this service. Thank you.
Director Elliott, before you go too far, I had a question. It's Riley at the Journal Star. Have any other cities sort of used a similar program? And is there any concern about the competition this might have with rideshare companies for at least the interim?
I will let Mike come up and address the other cities. It is my understanding that there is some cities using a similar service to this one. With regards to the the competing needs with the other ride services. This is not meant to be a competition with the other ride services. This is just very limited, both in the time frame of when it'll be running. Like we said, it's limited to 5:40 a.m. to 8 p.m. and 6:30 a.m. to 6 p.m. on Saturday, with no services on Sunday. So this is not to do those overnight, super early morning rides. And once the pandemic's over, we will go back to focusing on the handy van. We'll assess how the on-demand service worked for the public in general, but we will shift our focus back to the handy van. With regards to how other cities are using this, I will let Mike touch on that.
This is a new concept in transit ridership and transit service altogether. And so we've seen several companies, software companies, emerging with this type of idea. And there are definitely some European cities that have it up in operation today. There are other cities in the United States that are piloting something similar to what we're doing right now. And I don't recall exactly the name of those cities, but there's several of those cities that are doing the same thing.
Yeah, Riley, I first learned about this kind of opportunity for cities when I was at the New Deal conference in Washington, D.C. Last year, and West Sacramento, California is one city in the United States that we know has implemented sort of on-demand service for their public transit. So bringing that idea back to the community, just had some discussions early on in my administration with the transit team to see if there was a way to utilize these kinds of on-demand services to make our customer service more effective. And, you know, again, the plan was to go forward with handy van service, but given our current situation with the declining ridership, the need to still make sure that people who have to get to work and who rely on the bus to do that have a way to get to work safely, we thought this was a good time to accelerate our plans and provide valuable support to community members who are trying to continue to earn their incomes during this challenging moment.
I have a question from Charlie at Campbell about some of the transit packages. In particular, what is the Abbott Test? Is it new or better? And what is a reagent?
Thank you, Charlie, for asking. I try to be careful not to use terms like that. The Abbott Test is simply, it's a machine that runs a test. It's made by Abbott, so we call it the Abbott Test. Reagent is the material once a sample is taken, like if you have a blood drop taken or a nose swab done. A reagent is where you put that material in, and it's used to run the test to see if it's negative or positive. The advantage of the Abbott test, as we understand it, is that it usually can be completed in 15 minutes, which is fabulous. But the disadvantage is that only one test at a time can be run. But we still would be much further ahead in being able to have those results quickly and be able to treat people very promptly. So hopefully that answered your question, Charlie.
Are there any other questions? All right.
Thank you so much for covering our updates for the community, and thank you for tuning in. We appreciate so much. Thank you for doing what you're doing, all the leadership that each and every one of you is doing in order to protect the most vulnerable members of our community and our healthcare workers. And we'll see you tomorrow at 3:30.